Hello, and welcome to today's Heart and Stroke webinar. I will now welcome Pamela Fonseca, Health Promotion Manager at Heart and Stroke.
Hi, everybody. My name is Pam Fonseca, and I'm the Health Promotion Manager with Heart and Stroke based in Halifax, Nova Scotia. I'll be your moderator for today. And before we get started, we wanted to thank you for joining us on our webinar today. Heart and Stroke employees across the country have been working rapidly to bring you reliable and credible information as we navigate these times. For instance, on our YouTube channel, we recently uploaded a video created by our stroke best practice lead, who is also an occupational therapist, Rebecca McGuff, featuring hand washing for people who have had a stroke or have a weak or flaccid arm. In this time of heightened attention to careful hand washing, this video demonstrates one technique for washing the unaffected hand. So if you've not already done so, please visit our website at heartandstroke.ca, find us on YouTube, and follow us on our Twitter accounts, HSF Science, where we will constantly be updating resources and emerging information as it relates to heart, stroke, and vascular cognitive impairment. The reason why we were bringing this webinar to you today is after many questions and comments we've been receiving from you, the public. We acknowledge that information on COVID-19 is emerging at a very rapid pace and is generating many appointment disruptions, questions and concerns for people with stroke and VCI. And we know that inpatient stays are being shortened, both acute care and inpatient rehab. With social distancing and isolation, access to in-person rehab services has become a challenge. And we are hearing from people with these conditions who are currently starting, partway through, or completing rehab, who may be trying to cope with access issues and wondering what resources and supports are still available to them to allow continuation of their rehab efforts independently. So with this in mind, today our speakers will be discussing practical next steps to take in determining how to continue rehab and possible transition to virtual rehab during COVID-19. Available rehab resources and self-management techniques that are essential for people with lived experience and care supporters to continue their recovery at this time. And finally, practical rehab self-management skills to practice during social isolation. As you will hear from many of our speakers, we also want to emphasize the importance of connecting with your individual therapy and healthcare teams to determine what activities and strategies will be right for you. I'm pleased to welcome today 4 speakers who are experts in stroke rehab and will be sharing some timely information as the world moves to a more virtual means of communicating. I'll be introducing them one by one as we go. And again, a special thank you to our speakers today who are all taking time from their busy healthcare duties to bring us sound evidence and information. So our first speaker is Jen Bogart. Jen is a woman with lived stroke experience who resides in Charlottetown, Prince Edward Island. Jen will be speaking about her realities during social isolation and how she stays motivated and what she found to be useful in her stroke recovery. Over to you, Jen.
Thanks, Pam. What a joy to be here today, and welcome everybody. My name is Jen Bogart. I live in Charlottetown, Prince Edward Island. I am a stroke survivor with a congenital heart defect called a PFO, which has since been repaired. My stroke happened in 2013 at the age of 39. It left me with several deficits and a strong sense of hope that I would be better someday. Many of you can relate to my story. These are uncertain times. COVID-19 has swept the globe and rendered many isolated at home and away from their regular routines, workplaces, activities, and specifically non-urgent medical care such as therapy, rehabilitation, and treatment. In Charlottetown, many retail stores, all gyms, parks, etc. are closed. Leaving your home is a huge undertaking alone. The doors are closed, lights are off, and signs are up in many businesses. Getting your essentials at a grocery store can feel like a scene out of a movie. The days can be long, and when you are unwell, uncertainty can settle in. Uncertainty can feel like being alone, stressed, anxious, frustrated, and grieving. I'd like to share some tips with you that helped me during my recovery days that were long days at home while I recovered. Every stroke is different. However, I'm hoping this will help you feel better and get better. And remember, these are just recommendations that were given to me, and hopefully they will help. So with all this time at home, you have an opportunity to make this your new full-time job. your health and your wellness. So here goes. Here's my list. Number 1, I listen to classical music. My stroke psychologist recommended I listen to classical music, mainly because I couldn't sing along, and not that I'm a bad singer, but just that the music wasn't familiar. She said it would help build new pathways where damage occurred during the stroke. Effects of classical music on the brain are said to be that they can reduce blood pressure and stress, enhance memory, relieve pain, improve sleep, and fight symptoms of depression. On CBC Radio, there are 2 shows I would recommend. The first one is called In Concert, and it's Peter Paulo's show. It is a live concert, orchestra, and recitals, and it plays on Sundays. The second show is Julie Nasralla's Tempo. It is a classical music show with stories, and it plays every day mid-morning. I can tell you it helped me greatly. Number 2 is relaxation. You may only have so much energy. You may feel exhausted. Rest is what you need. Your brain needs to recharge by resting. Eliminate bright lights and unnecessary noise. You may have a hard time laying still, so I would recommend trying a relaxation inspiring app on your phone called Calm, which plays meditative calming instrumental music. It was recommended to me to shut down all electronics, that includes TV, computer, your cell phone, at least 1 hour before bedtime to let your brain rest from blue light. Number 3, physical activity. Mind-body connection is so very important. Walking and yoga were my go-tos. Yes, I was a very slow walker at first, but it takes time and your body will thank you. YouTube is a wealth of resources for free yoga. I like Adrienne's yoga. It's a show called Yoga with Adrienne. Pretty simple. She's a great instructor, and anyone at any level can do it. She's also a Texan, and she's quite cheeky and funny. So even now in quarantine, I still go for walks around my house and continue my yoga practice with Adrienne. As for walking, please check with your provincial health authorities to be sure this is still okay before you set out. Number 4 is brain play. And this was the most difficult, but the most fun. So like many survivors, I had one affected hand by my stroke. It was my right dominant hand, and I had difficulty picking up a glass or holding small objects like a pencil or a paintbrush. So I did some pretty neat activities just to build up the strength in my affected hand. And I think you might enjoy them too. I built Lego structures, anywhere from cars to buildings to flowers to spaceships. I practiced imaginary lists, like a grocery list, or I would look at things around the room and write them down. I played Sudoku. I read out loud. I did puzzles in Light-Bright. I colored, and I practiced doing buttons and zippers. Later on in recovery, I took up pottery, which obviously isn't available right now due to the closures, but I also started baking. And it is amazing how challenging it can be to follow a recipe, put everything together, bake it, and try not to burn it. But as I say, practice makes perfect. Number 5, community. During my recovery, my occupational therapist made the best suggestion when it came to grocery shopping. She suggested I go to the store when it was really quiet and less busy. This was typically in the early morning or then again at supper hour. I have continued this habit even now, 7 years later. Something to note, Sobeys hosts a sensory-friendly shopping experience once a week. It's all across Canada. They dim the lights and they reduce ambient noises, such as the ding of the cash register. The coolers are, lights are turned off in the cooler. They dim a lot of the lights in the store. And this is designed specifically for autistic sensory disorders, brain injury, and others. Keep in mind that if you must go out to get essentials, please follow the directives, such as washing your hands, don't touch your face, and of course, keep your physical distance. If you are unable to go out by yourself, reach out to family members, friends, or neighbors to gather items for you. Remember that friends and family want to help. Don't be afraid to ask. They can always leave your groceries on the doorstep. or arrange for your local grocery store to do a grocery pickup. They're doing a lot of online ordering here in Charlottetown, and it's working really well. Also, some grocery stores and pharmacies may do home delivery. Also, if possible, keep in contact with your therapy team. For example, my occupational therapist gave me her cell phone number so I could text her when I was feeling unsure or needed her help. This was exceptionally helpful and kept me on track. Keep in touch with family and friends during this time. Text them, call them, email them, whatever you need. It will help you. It helped me enormously to stay motivated. And I think it's really important during this time as well if you're self-isolated. Finally, if you are a Facebook user, Heart and Stroke hosts a page called Community of Survivors. It is a private group designed to give each other support in a positive, engaging way for survivors and caregivers, and I encourage you to join and stay connected. Thank you all. I hope these tips help you. Remember that you can do this and remain positive. Celebrate those small things. Find courage and strength. I was there too, and I made it through, and you can too. Stay safe, everybody, and thank you very much.
Thank you, Jen, for sharing your experience with us. It takes a lot of courage to share something so personal with a large audience such as this, and we really appreciate you taking the time to do that today. Now, we will turn it over to Debbie Timpson, Dr. Debbie Timpson. Dr. Timpson is a specialist in physical medicine and rehab at the Pembroke Regional Hospital in Ontario. She has been on the writing group for the Canadian Best Practice Recommendations for Stroke Care and sits on the Stroke Best Practice Quality Advisory Committee. Over to you, Dr. Timpson.
Thanks, Pam, and thank you so much, Jen. We're really grateful to you for sharing your experience, thoughts, and suggestions with us. It's very helpful and really good to hear from someone who's lived through this, and you've had great ideas that people can incorporate, and we're so glad you've recovered well, so thank you so much. I would also like to welcome all the participants to this webinar, and I know that there are many of you who have had a stroke or are supporting someone who has had one. And having a stroke can be stressful and life-changing. But having a stroke during these unprecedented times of COVID-19 pandemic can be confusing and overwhelming. So what I'm planning to do over the next 15 minutes is to discuss what you should be doing related to the pandemic to keep yourself safe, then discuss how stroke recovery occurs, and then provide a broad overview of principles to keep in mind for continuing on with rehab at home. So first, I'll talk about COVID-19. So as you're no doubt aware, COVID-19 is a new coronavirus that has caused a global pandemic, and we're still learning more about it every day. I know here at the hospital we get different information almost every hour, it seems. We know it's mainly spread from person to person through respiratory droplets, from spraying when talking or when you cough or sneeze. We do know that older people and people with underlying medical conditions have a higher risk of developing complications should they become infected with COVID-19. So it's likely then, if you've had a stroke, you're in this higher risk category. So it's crucial that those who have had a stroke do everything possible to avoid infection. So if you put the first slide, oh, it's there, okay. It's important to follow public health guidelines. 1, stay at home and self-isolate. Those you live with should also be staying at home if at all possible. The only people who should come to your home are those who are crucial to your well-being. For example, a personal support worker helps you get washed and dressed or have a shower, a nurse who checks your vital signs, and so on. Relatives and friends should not be visiting in person, even though this is extremely difficult in these trying times. But perhaps they could check in regularly by phone or video. 2, practice thorough and frequent hand washing. Hands should be washed for at least 20 seconds using soap and water. And if you're somewhere where you need to wash your hands but there isn't soap and water, using a hand sanitizer that is at least 60% alcohol-based is an option. And as mentioned, the Heart and Stroke Foundation website has a video on how to wash your hands if you have one hand that's not working very well. So I recommend you look at that. 3, avoid touching your eyes, nose, or mouth. 4, cough or sneeze into a bended elbow. And if you use a tissue, make sure you throw it immediately into the garbage. And 5, details are still emerging about the transfer of this virus from surfaces. And the current suggestion is to frequently clean and disinfect often touched surfaces with a bleach-based solution. Next slide. For safety at home, consider the following. 1, take all your medications as prescribed. Ensure that you have an adequate supply at home and that your prescriptions are up to date. If your pharmacy delivers, use that service so you don't have to go out. It's wise to keep a list handy of all your medications in case others need that information. 2, have an emergency contact list available, including the names and numbers of your family, caregivers, and healthcare providers that you can share should the need arise, and carry this with you if you leave your home. Similarly, carry information with you documenting your health conditions, including that you've had a stroke. This is always important, but I think it's even more crucial if you have aphasia and it's more difficult to communicate. 4, consider obtaining a personal mobile medical alert device where you can press a button to receive immediate help should you have an emergency and can't get to a phone. 5, try to use a grocery delivery service. If unavailable, then perhaps someone you know could safely deliver supplies to your door and leave them at the door. If you must go out to get your own groceries, try to go at quieter times, just as Jen mentioned, or at times designated for older and vulnerable people. And when you are getting your food, try to carry on with the low-fat, low-sodium diet. People don't get out of that just because of the pandemic. 6, if you must go out, this should only be for essential service, but you must maintain at least a 6-foot distance between you and others who do not live in your household. Similarly, if you go outside for fresh air or exercise, the 6-foot distancing is still required. If you answer your door to pick up a delivery, you must still maintain this distance. 7, many doctors' offices are still open, but care is often being provided virtually by phone or a video conferencing system. Also, many provinces have a phone number that you can call to access a nurse for medical advice. And now most provinces have a public health number that you can call as well, and especially related to the COVID pandemic if you have particular questions or you've developed respiratory symptoms and aren't sure what the next steps are. If you have a problem for which you must be seen in person, not just by phone or video, healthcare providers know how to see you following public health guidelines to keep you as safe as possible. I want to emphasize that if you're having a medical emergency, you must call 911. For example, if you're having chest pain or if you're experiencing new stroke symptoms, life-saving care has to be provided at the hospital and time is of the essence. Please do not ignore these symptoms. Please do not be so scared of coming to the hospital that you remain at home with these serious problems. Our hospitals are still open for business, and medical professionals are doing everything possible to ensure your safety and reducing the risk of contracting an infection should you have to come to the hospital. So now I want to shift the focus to stroke rehab care. At this time, most acute stroke units and inpatient stroke rehab units remain open. However, allied health professionals like physiotherapists, occupational therapists, speech language pathologists, and social workers will not typically be assessing and treating people in person in their homes or in the community. This expectedly is going to result in concern about how a person living with a stroke at home can continue to improve from the stroke and how caregivers can also receive support and provide support to their loved one. Many health professionals will still be providing care, but it might be in a unique way via phone or video technology. So now I want to talk about recovery processes after a stroke. In the first few weeks after a stroke, some natural recovery takes place regardless of rehab. The stroke itself, as you know, causes brain cells to die off, and these dead brain cells do not regrow. However, around that core area of stroke, there are some brain cells that are stunned because of edema or swelling, or chemicals that are released during the stroke itself. As the swelling goes away, these stunned brain cells start to work again and improvement in function can occur. And this process does not rely on rehab interventions. However, longer-term improvements can happen for weeks, months, and even less so for years. This occurs for a number of reasons, but mainly due to the fact that the brain has some plasticity. That means that part of the brain that didn't used to do a particular function can be trained to take over for that lost function. The way this generally happens is to work on repetitive tasks that then create new pathways in the brain, just like Jen was mentioning earlier. This is where rehab becomes especially important. And it's also important to remember that rehab is a process and not a place. And this work doesn't have to take place in a clinic or a hospital. It can take place in your own home. The next slide, yeah. Now I want to talk about some broad suggestions for what you can do to keep on with rehab interventions at home, even if you do not have access to in-person therapies. So if you're still an inpatient, you're likely, unfortunately, not allowed to have any visitors. However, you and your family can still receive advice from your inpatient care team, and please ask your team to provide you with instructions as to what you should be doing at home. If you're at home already, these questions are still important and may arise. So find out the following. These are just some examples. What exercises should you be doing? How do you progress these exercises at home? Should you do more repetitions? Should you use weights? Should you increase the weights? Should you be doing your exercise program seated or standing? What is safest for you? What equipment is needed for the exercise? What communication strategies should you be using? If you need to use supported conversation techniques, how can your family learn this? Should you practice writing, reading, talking? Are there any homework sheets that you can get? What about practicing getting washed and dressed? What dressing aids are needed? A reacher, a long-handled shoehorn? What about walking? Should you be walking? If so, do you need a walker? Or do you need a walker in a wheelchair? Or are you going to mainly be getting around by a wheelchair? How do you get this equipment prior to discharge? Or if you're already home and find you need it, how do you get it? If you need your home assessed prior to discharge for safety, what can a family member do to help? Can they take measurements of doorways, heights of beds, take pictures? Or if no family member is available, are there any suggestions that would be of benefit to your care team? Get ideas on how to get grab bars and railings installed if a contractor is not allowed into your home during the pandemic. If a family meeting is needed, this can still be done virtually by phone or by video conferencing, and we certainly use that on our rehab unit and it works well. Ask if written information can be sent home, and ask your inpatient care team to contact the home care providers or private providers to give them information about your needs prior to discharge. Or if you're already discharged, in reverse, the home care providers and private providers can speak with your inpatient team should they have questions. If you've already been discharged home and you don't have a plan for your home rehab, I'd suggest calling a member of your inpatient rehab team to advise on the next steps. If, however, you weren't seen by a rehab team at a hospital, then you could call your family doctor or home care organization, and they may be able to help you connect with the appropriate healthcare providers. However, at home, there are some basic principles to follow. First and foremost is to do no harm and to stay safe. Follow through on programs that were set up for you in the inpatient acute stroke unit or the rehab unit if you had the opportunity to be there. If you don't have a program and haven't yet reached anyone for guidance, keep in mind that what helps to create new brain pathways is doing tasks that are important to you repetitively over and over to make those pathways. You can do this on your own or with the help of people living in your home, even without a therapist being there with you. For example, if you like to do the laundry, not something I like to do, but folding clothes is an important repetitive task. If you like to bake and you can actually get flour, cracking open eggs, measuring and stirring can be fun but repetitive tasks. But you should have confirmed that you're safe to use a stove or oven. Even getting washed and dressed involves some repetitive actions. For aphasia, you might be able to work on tasks like reading, writing, or just talking out loud. It's very important not to injure yourself while you're doing your activities. So if you have a weak shoulder and you have to use the other arm to help move it during exercise, don't raise your weak arm beyond shoulder height unless you've been advised otherwise by your team. Don't use pulleys to get more movement. If your toes catch when you walk, be extra cautious and raise your foot up by bending more at the hip and knee, or better yet, use an ankle brace if one was made for you and is still fitting comfortably. Be extra cautious on uneven ground. Use railings for stair climbing and don't carry anything in your hands up when you're going up and down the stairs. If you have poor feeling in your arm or leg, make sure you look at them often to know where they are. Check bath or shower water temperature with your good hand before you get in to make sure you don't burn yourself. I also recommend setting up a schedule or routine. Try to get up at the same time every day. Set aside particular times to work on specific rehab tasks. One of our OTs was saying today that she thought this would be just like working from home and setting up your office at home, where you have your own schedule and equipment and so on set aside for that. Try to do your exercises for at least 45 minutes a day, more if able, but also schedule in rest times, as many people with stroke experience fatigue. Caregivers also risk burnout when you have less supports available. So if possible, try to schedule in rest times for yourself too, if you're a caregiver, and seek some emotional support from others. Clear a space at home where you can work on your tasks or exercises and keep necessary equipment there. If you aren't living alone, your family might want to participate with you. And if you are living alone, maybe your family might want to participate via phone or video to encourage you. For many of you, there may still be an option to connect to therapy staff, and we're going to hear about that shortly, through home care virtually, on the phone, or through video conferencing, and use this service if you can. If you aren't sure about a particular exercise program and what would be safe, I'd recommend starting with a program that you can do from a seated position. Do not exercise to the point of fatigue or pain. If you've been cleared to do a program that involves balanced tasks or walking, do only what was recommended, as these tasks can be more risky. If you've been cleared to exercise outside, be cautious of uneven ground and curbs and maintain the recommended social physical distancing. This can be an emotional time for all, so try to touch base virtually with friends, family, and healthcare providers who can provide emotional support through this journey. More information about stroke recovery online supports will be coming through organizations like the Heart and Stroke Foundation. And the Heart and Stroke Foundation already has a lot of resources for professionals and the public on their website, and that can provide guidance. So while this is an unsettling time for all of us, we have a lot to be grateful for. We live in Canada with an excellent healthcare system, and we're all committed to working together to get through this as safely as possible. And I'm just going to end there, and we'll pass things on to Pam and to Manny. Thank you.
Thank you, Dr. Timpson. Your insights into the practical things that people can be doing at home to continue their recovery journey during this time is really helpful, I know. So thank you. Our next speaker is going to be Manny Paiva. Manny is the manager of the Inpatient and Outpatient Community Stroke Rehab programs at Parkwood Institute in London, Ontario. Given our current situation with COVID-19, stroke rehab teams have been tasked with finding new ways to deliver treatment to our stroke survivors in a way to allow them to keep moving forward with their rehab journey. So Manny will share his rehab team's experiences and discuss how others can feel more confident with their abilities in navigating a virtual rehab world. So Manny, I will pass it on to you.
Thank you so much for the introduction, Pamela, and to all the other speakers so far. It's been great hearing all the pieces of advice that you're sharing. So I just wanted to say I don't have anything to disclose at this point in time, but I did just want to let you all know that I am presenting this presentation on behalf of two of our therapists, occupational therapist Martha Scott and speech language pathologist Crystal Bronco, who couldn't be here today to present because they're working hard at trying to figure out how they can continue to deliver rehab for our stroke survivors in the community who aren't able to come to the clinic or receive home visits at this time. So just wanted to let you know that I am sharing all this information on their behalf, and very happy to do so. Okay, so now that I have control to advance the slides, I wanted to start off with just an easy definition of what is virtual rehab. So for the purposes of this presentation today, we're going to define virtual rehab as receiving any type of rehab services that are going to be delivered over a video conference. So it's not being in those physical, personal and visits that we are used to taking place. And in regards to, you might be asking yourself, why virtual rehab? Why would I want to get involved in this type of care? And I want to just use 3 words to describe why you think, or why it would be important to consider this type of rehab. So personally, you know, there's the convenience, there's the choice, and there's also the access to services. So in regards to convenience, you know, you don't have to worry about people entering your home, getting ready for people to enter your home, the tidiness, the pets, any other family members that might be in the home. You might be really comfortable using technology, and this is a method that really fits with you and your lifestyle. Other reasons, for example, maybe you or your therapist are just getting over a cold and you don't feel well enough to have somebody come into your house, but you don't want to risk contamination, but you could still consider doing that video session in order to continue to guide you and continue with your rehab. Also, if there's inclement weather where a therapist isn't able to drive out to see you, instead of having to go ahead and cancel that visit, the therapist would still be allowed to or able to continue, again, to help you with progression of your rehab. It's also just the consideration of having that phone with a face. So it's basically like a glorified phone call where you're at least having that face-to-face visit with the individual on the other end, just to help with developing that personal connection. There's also various formats can be used. So we're able to give clients the choice in how their healthcare and how their rehab is delivered to them, and their say in being able to say how they want to receive rehabilitation services. And again, it's nice to see over the face-to-face to see that the patient, you can take verbal cues. So again, you can see those subtle cues of facial expression or nodding. But even better, it's the ability for the therapist to be able to demonstrate a concept and for the patient to demonstrate what they're doing to the therapist, as opposed to just trying to describe that concept over the phone. And in addition, in regards to that access, it's really decreasing the travel time that it's taking for our therapists to go out to people's homes, which again might be able to increase the number of people that our therapists are able to see in a day, which again helps with the access for individuals to continue to receive therapy. I want to talk a little bit about what is needed, because people are actually quite surprised when they find out that the technology needed to conduct this type of visit is pretty limited, and in most cases people already have this type of technology. So just starting with the device, it's as basic as a laptop, a desktop computer, a smartphone, a tablet. Those are basically the four that we would consider needing for this type of visit. In addition, what we would talk about are things like a good webcam, a good microphone, a good set of speakers, and in most cases, again, a lot of these things are already built into the devices. So most standard laptops will come with a webcam, a microphone, and speakers already installed. However, some individuals do choose to also purchase those peripherals, like purchase an additional microphone or a speaker or a webcam, just to help with the quality, and again, with the video quality and the sound quality and the hearing quality as well. Some programs, depending on the platform that you use for video conferencing, some will require an app that you can download from most app stores or Google Play stores onto your phones. But again, others are not based on apps. The most important thing to consider is definitely a strong internet connection. So you really require that good internet connection in order for the virtual portion to be successful. And most apps, again, would require you to have some type of email, because what happens is the platforms will send the individuals a link that's sent directly to their email, and then following that link in the email is what allows you to join the video conferencing session. So again, a lot of websites out there offer free and secure emails such as Gmail or Outlook, or Yahoo. Those types of things, again, would offer a free email that would allow you to be able to access to offer these to use these virtual platforms. Some of the ones that we're using at the hospital, we are currently using OTN Hub and using the personal conferencing, but we're also using at the hospital, we're using WebEx. So again, those are the platforms, this is examples of some that you may be familiar with. But there are also other social media platforms that could be used for this type of service. So for example, Zoom or Skype, FaceTime or WhatsApp. And those are, again, just some examples of potential platforms that could be used. What you would want to consider when you're thinking about these platforms is, again, a couple fold. So firstly, you do need to think about, are you working with a hospital organization? Because in that case, then there likely will be privacy and security legislation that the hospital will be required to use. So that may restrict the types of platforms that you would be able to use for the virtual visits. It's also important to be considered if you're not going to use those platforms such as OTN or WebEx, which do meet the hospital legislation. It's important to think about what are the potential risks. So using some of those other platforms like Facebook Messenger or WhatsApp or FaceTime, again, we just can't guarantee that there is some information that may not be intercepted or some information couldn't be disclosed by an unknown source, which is why we wouldn't say that those are meeting the hospital legislation. However, if that's still, you may be willing to take that risk as a client if the benefit of receiving that virtual visit is outweighs the type of information that's being shared that you're concerned about. So again, having that type of agreement with your clinician and the patient agreeing on that to use that type of platform would still allow you to use some of those other platforms if that's what works for you. It's also really important to consider the environment. So, as the healthcare provider that you're working with, are they in a private space? Are they sharing an office space? Are you in a private space? Who else is in the room that you may not want present? And then it also example to what else is around you, or who else can see you, or do you need somebody to help you set up that equipment? And if you do need somebody, what are the boundaries that you want to set with them in regards to leaving the room after you set up the call? So just some things to consider. I wanted to share some examples of what we're currently doing. So with this technology, our team has successfully started to provide personal therapy visits and assessment. So we have been able to upgrade exercise programs. We've been able to do initial interviews. We've been able to do kitchen assessments, demonstration of exercises successfully with our clients. We've also been training support staff. So people that may be coming to your house to assist you with tasks, we are able to train them on some specific exercises, as well as educating your caregivers. More excitingly too, we have been able to run some groups using virtual visits. So we have an aphasia group currently running, as well as a memory group. And again, just to let you know, our staff members are successfully using this to stay in contact with each other, to communicate well, so that we can keep your programs moving forward. Of course, with everything else, there are some challenges. So wanted to bring those to light. Sometimes people don't have necessarily that comfort with using technology. Sometimes individuals who are maybe experiencing some cognitive difficulties may need a little bit of extra support to carry out that task. So having that caregiver could be beneficial. Sometimes, again, that poor internet connection can make things frustrating, or if you're trying to do too many attempts, that could lead to some frustration. So again, my advice is just quit while you're ahead. Try, get as far as you can. And if you need to put it on pause and come back to it, that might be a good idea, just again to save you that frustration. But don't be discouraged, and try again. And just to know that some videos and audio might not work well all the time. It may be choppy, so just keep that in mind. It's not going to be perfect, but it is a good alternative. And I also just wanted to share some tips for success. So again, it's really important to establish that rapport, either in phone first, to kind of get you going. Be patient. Ask the person on the other end for patience as well. It is something that is all new for us. Prepare for disruptions and be ready for that, because it is something that can happen, but also have a plan. So right away when you're on the call, the first thing to do with your patient would be, with your clinician, would be have a plan for if the call drops, what are you going to do to get back on together with your clinician. Find somebody who can help you, and if you're needing that help, and have some contact info or a plan for support if you need. Make sure that you're sitting close to your router. Turn off other notifications that could be disruptive. Put your phone on silent that you don't need, that you're not using for the current platform, and speak slowly. And then again, check-ins. Making sure that those check-ins are, so that everybody's still on the same page, is really important. If you're working in a group, just attempt individual trial connections before the group starts. Plan again for those difficulties and try things ahead of time. Have a facilitator and somebody who can help with connectivity difficulties for your patients and your clients that you're working with. And then again, just review how to turn on and turn off the microphone, because it'll be important for that muting and establishing people on the other line so that everybody can hear each other. I just wanted to share before I get off, just share some words from clients. Don't be discouraged. And our clients are saying that they quite enjoy using the video conferencing, and it lets them see that they're able to detect any changes, and it also allows people to observe what people are doing on the other end. Again, it's a really important tool to use, and the adventures out there. And again, don't be discouraged to try something new, because we're all willing to try to help and see what we can do to continue to progress your rehab in the community. Thanks, everyone.
Thank you. Thank you, Manny, for sharing some of those key tips and tricks for smooth virtual rehab. Our next speaker is Dr. Janice Ng, and she's a professor and Canada Research Chair in the Department of Physical Therapy at the University of British Columbia. She's also the director of the Rehab Research Program at the GF Strong Rehab Center, which is part of the Vancouver Coastal Health Research Institute. And over to you, Dr. Ng.
Oh, thank you very much. It's been wonderful to have Heart and Stroke organize this so quickly, and thanks for the other speakers for really setting me up. I don't have any disclosures.
Do you want, I can advance it for you if you'd like.
Yeah, advance slides, it's not going.
Go ahead, there you
go. Okay, so I'm going to talk about some upper extremity function programs, and this is one we've developed over the last 10 years, and it's called the GRASP program. It stands for the Graded Repetitive Arm Supplementary Program, GRASP, and we developed a home version a few years ago, and it can be done at home. It was done with weekly check-ins from a therapist in person, or we did another set which was done completely by phone, which was very successful and has been shown to improve upper extremity function. We also have a component where participants are really encouraged to increase their use of their affected arm and hand through the day. Next slide. So what is the evidence? So the clinical trials have shown that GRASP that was weekly supervised by phone or in person improved arm and hand function. It's used all over the place. It's free to download. We know there's at least 1,600 places in 42 countries that's using it. We did a survey, and about a quarter of the UK therapists use the GRASP. It's part of the Canadian Stroke Best Practice Guidelines, so it's locally grown, which we're happy to say. And it's used one-on-one and also in groups, supervised by physical therapists, occupational therapists, and rehab assistants. It is, as we say, an evidence-based program. So hopefully you can access something like this and just don't go to YouTube and pick something up that might not have evidence behind it. Next slide. So who would benefit from the home GRASP? If your arm and hand has been affected by a stroke and you're at least able to partially open your hand without assistance from the other hand to pick up or grasp something small like a glass or a small block. And you're motivated to improve that hand through practice. And it does take a lot of practice. We recommend at least 1 hour per day and a minimal for 8 weeks. And it is helpful if you have someone to help you with that, and that might be a caregiver who can keep track of the exercises or help arrange some of the equipment. You shouldn't have shoulder pain. And we really recommend that you consult with a physical therapist or occupational therapist to see if this program would be appropriate for you. And as mentioned by other speakers, there's lots of therapists that are still doing video consults, phone consults, so that would be a good thing to check on. Next slide. So how does the program work? As mentioned before by Dr. Timpson, that really repetitive activity is really important for improving brains. It takes thousands of daily challenging arm and hand repetitions to improve brain circuitry. So the GRASP program results in about 800 to 1,000 repetitions in an hour. So it's there, it selects the kinds of activities that we know are important to improve after a stroke. And we also know not only doing the exercises, but also increasing the use of arm in your daily routines will help improve that brain's ability to control your upper limb movements. Next slide. So what is required? We try to really keep this low tech. The manual is free to download at that link below, so www.neurorehab.med.ubc.ca. And there's a manual for an instructor manual, as well as the exercises itself that you can follow along. There is a kit of equipment, and I would say 90% of the pieces you can find in your home. So there are things like cups and forks. There are a few things like a weight, a gripper, and TheraPutty that can be purchased from online sources. We preferably have some guidance from a therapist to ensure the exercises are appropriate and progressed. And supportive caregivers are really, really helpful. We do have some videos as well on the website that you can watch, one that provides an overview of GRASS and others that provide tips of that I think are both useful for clients and therapists. In terms of caregiver support, those that had caregivers assistance had better outcomes, and we really recommend caregivers can help by organizing the equipment, motivating, being a coach or cheerleader, because that is really important. These exercises can be frustrating, and it is really helpful to have someone there along to help out and really cheer and motivate those people along. And even to record how much activity is being done. And also to encourage people to use their stroke affected hand. And that might be playing checkers, playing cards, or things like that, that really help people to integrate their stroke affected hand in their daily activities. Next slide. So this is just a sample of what the GRASS participant exercise manual looks at. It provides some justification. Why do I need to spend so much time on these exercises? It just really explains that you need thousands of challenging repetitions to improve your brain, and then in turn to improve your hand function. Next slide. It then provides some samples of the exercises and some ways to increase the grading of it, so how to make it harder. We provide some tips to doing the exercises correctly. And as I said, we also have videos that you can go to our website and look at as well, because it also provides some tips. Next slide. And then we also provide some advice about using your hand as much as possible through the day. So not only doing the hour of exercises, but also how can you incorporate it, doing simple things such as turning a key when you open a door, brushing your hair, opening a drawer. The more that you can use your stroke affected hand in a safe way, and the more that you get stimulus to your brain. Next slide. And we just like to acknowledge our funders, particularly the Heart and Stroke Foundation and the Canadian Institute of Health Research that has provided funding for this project. Thanks for listening.
Thank you, Dr. Eng, for sharing some more information about the GRASS program. For those interested, we also have more information about GRASS in addition to what Dr. Eng shared on our home exercise programs page on our Heart and Stroke website. So we'd now like to open the remainder of the webinar to a Q&A portion, and Patrice Lindsay of Heart and Stroke Director, Systems Change and Stroke Program is actually going to help moderate some of these questions for our experts. But before I hand it over to Patty, we'd again like to thank all our speakers today for offering their time and expertise for this webinar. We hope you as a webinar attendee leave here feeling connected to others in your situation and that you have received credible information from experts in these fields. Now over to you, Patty.
Thank you so much. And everyone, please submit your questions. We do have some coming in. First and foremost, what you've submitted most is to Jen. Jen, the entire group of over 700 people listening are sending you a huge hug and just absolutely thanking you for your honesty and your courage. So the questionnaire section is flooded with compliments for you. So please take that, you're loved.
Thank you.
You're welcome. Second of all, to Dr. Timpson. So how do you determine in this situation when a patient who's finished their stroke out back in the community needs to actually be seen in person? And maybe Dr. Timpson, you can comment, and then Manny, maybe you can talk about whether you have any criteria in place as well.
So if someone's in the community and needs to be seen in person, I would think that if they've already been seen by healthcare professionals, would probably be if there was a new problem that had developed. So for example, a new neurologic problem, pain, those sorts of things. And then they would need, I think my recommendation would be to get in contact with either the rehab team or your healthcare provider, like your family physician, to get advice about that. However, if it was something that came on acutely, that would be when we'd want you to call 911, and you definitely need to be seen in person for that. If it's not really related so much to rehab, but it's any other medical issues, so again, new neurologic symptoms, chest pain, you've developed a fever, respiratory symptoms, those sorts of things, you need to be seen. Hope that answers.
Manny, thank you. And Manny,
Yeah.
how do you manage that with your program to know when somebody actually needs to see you guys?
For sure. Yep. So again, we are allowing some home visits, but again, it would need to be approved by our leadership at this point in time, just given what's going on with the COVID-19 crisis currently. And our patients and our clients in the community have been so receptive to that and very willing to follow with our recommendations. But we are allowing our clinicians to go in on approved visits related to rehab needs if we're finding that there's some difficulties, especially related to safety. So for example, if there's like a swallowing that needs to be assessed that really needs that in-person visit, or if we're finding that an individual is having a lot more falls since they've been home and we don't know why, and that potentially could benefit from an in-home visit, then we would allow that individual, the therapist, to go in and conduct those visits. Again, after completing their screening and making sure that it was safe to do so. But we're really just treating those kind of high risk situations pertaining to safety in which we could work on potentially helping from a rehab perspective that would be allowing to go into the home at this point in time. Anything else that we could do over phone or virtual, we would consider that as a first option.
Great, thank you. Dr. King, question for you. People love the program that you've presented and want to know if there's an equivalent lower limb program.
So actually, we just posted on our website, it's fameexercise.com. And we had a group program that we did called Fitness and Mobility Exercise, FAME. And we put some tips of how one might use some of those exercises at home. So we have a 2-page handout of exercises that are really commonly needed post-stroke, and some tips about how to do the program safely, and hopefully with some consultation by a physical therapist. So it's on our fameexercise.com, and it's free to download as well.
Great, thank you. And I have a question for all three of you. Do you find with moving to a virtual environment that there's a bias with more younger people because they tend to be more tech savvy, being given access to the therapists and the programs, and a bias where older populations who might not be as tech savvy or have access are being excluded from participation? I'd love to hear from all of you on that. Maybe start with Debbie, Janice, Manny.
Yeah, so I think that actually is a risk. So I think there is potential if somebody actually happens to be in a hospital setting, the acute stroke unit or the rehab unit, to maybe try to get some of that set up before they go home. So that could be part of the rehab in-house. So for example, with no visitors now coming into our hospital, we have iPads. Many people, even if they're not tech savvy, have phones, and we try to teach some connections before they go home. But yes, younger people are much more savvy on this and keen to do virtual therapy. But the older people who are less tech savvy are very much able to learn this. I think one of the things for us here in where we are is it's more rural, so sometimes the Wi-Fi connections and so on are a bit of a challenge too. So we have to work around that. But yes, definitely potential for learning, and I think it's good to start that at the hospital if it's at all possible.
Thank you. Janice, do you want to make a comment in terms of the GROS program and age impact?
Yeah, so we've actually worked with a number of the private practices who are doing both the FAME and our GRAS program by tele-rehab and by video conferencing. And many of them tell me that they actually have a son or daughter who is actually facilitating that technology. So I think actually they haven't seen a lot of biases, that it's just young younger individuals wanting these services because they're often facilitated by a son or daughter who is, or caregiver who's helping. So it does seem that some of the older adults who may not have the technology themselves are getting some assistance. So that's great to hear.
Okay. Manny, would you like to comment from your practice?
Yes, for sure. So luckily, because of we're lucky to have the complement on our program, but because we have the community team that's also attached to our rehab program, we have shifted some of our resources. So the rehabilitation therapists that would typically be working in home, we've shifted to some of those individuals helping on our inpatient rehab unit, and they're assisting with things like that transition from the inpatient unit out into the community. So we have been lucky to have our rehab therapists working with those individuals who are coming up to discharge and getting them set up with that technology prior to them going home. So making sure that they have the technology that's going to be needed, and then also doing some test runs with their family members even prior to them leaving. So we've had some really great success with that. But again, even if that hasn't been in the case, I do want to say that a lot of our older individuals are really successfully using this technology, whether or not we've been doing it, guiding them over the phone or using tech support by the platform. But also, as Dr. Ng has said, many family members or caregivers or support people that are going into the homes have been helpful with setting up this technology.
Great. And I have a question for Jen. So your checklist and the list that you provided and the ones that actually all of you provided are really helpful. Would it be okay if Heart and Stroke took those and created a little checklist form and made it public? Everybody's asking for your lists.
Absolutely.
Yeah.
And Jen, maybe the other question to you was, what other things are you hearing in the community of survivors that is really important that are the challenges right now that our other guest panelists can address? Is there any other themes coming out?
A lot of the themes have to do with just whether or not they should be going out of their home, if they're safe, if they're at high risk, those items. There's also, just on the flip side of that, there's a lot of like really motivating quotes and encouragement to stay strong, stay connected. So if the rest of the panel could just address the high risk part of being a stroke survivor.
Sure. Debbie, do you want to start?
So I think in my part of the discussion, I was talking about some of the public health guidelines that are pretty clear about self-isolating, and if you have to go out, it should only be for essential things. And then you maintain the 6-foot distance if you're with someone not in your household, those sorts of things. So I think we have to take these very seriously to, flatten the curve of this pandemic and to keep everybody safe. And people who have had a stroke are more vulnerable, so I think it's really crucial to follow those guidelines. And again, that can be challenging because you are more alone if you're self-isolating. But then if you have been set up with the virtual technology and you can connect with people that way and so on, I think that's really, really important. So I think all of the things that we've talked about through the discussion here about washing your hands, if you must go out to the grocery store, because you can't have a delivery, go at the earlier times that are set aside. Those sorts of things I think are crucial.
Great.
Thank you.
And so final comments. So Debbie, you've made yours. Janice, final comments from you?
I just hope that people look towards some of the Heart and Stroke resources that are evidence-based, because I know there's lots of stuff out on YouTube in terms of exercise programs, both for the upper extremity and the lower extremity. The Heart and Stroke does have some that they are recommending that are evidence-based, and I think they can be best utilized if you have some guidance from a health professional. If you can make contact either from the community or private practice that can provide you some tips, I think that would work best in terms of your progress. So that's something I would recommend if you can. And as I said, many of the community therapists are providing services now under a private practice banner using some type of phone-based or video-based guidance.
Thank you. Well, unfortunately, our time is up. I just want to thank all of you from the bottom of our hearts. It was fantastic. Your audience stayed on the whole time. You had a huge audience. I'd also like to acknowledge the Canadian Partnership for Stroke Recovery, who are really worked on this with us and gave us great suggestions and inputs. So together we're going to be creating some resources for everybody. We'll be putting some videos up online that they're working on with Calgary group. And just everyone, be safe, be well. It is Easter weekend. People are going to be sad and lonely that they can't be with family. So connect with them by phone and video, and just take a few minutes for yourself to, be glad you're safe and healthy at this point. And we're here for you, whatever you need. So thank you all. And this concludes today's webinar.